Welcome to CEO Money. I'm Michael Yorba. Thanks for joining with us. I have Marcy Rogers on the show with me today. She's a CEO and founder of SpineMark. Marcy, welcome to the show. Thanks for being here.
Thank you very much, Michael, for the invitation.
My pleasure. All right, we've spoken before on the show. I wanted to drill down deeper into the product mix that you have. Bring one of your companies out to the service. It's Prevacus or Prevacus?
Prevacus.
Let's talk about that one.
Okay. Well, Prevacus is, a great segue from the show we did a couple of weeks ago about Prev Pro as a concussion deterrent. Prevacus is a new drug that's starting their clinical trials this fall in Australia, and then moving to the U.S., to Mississippi to start the next phase. It is the first drug that will treat a concussion, and it can be administered anywhere, on the side of the road, in the field of battle, on the football field, on the soccer field, and it goes to work immediately. We even advocate when it comes out that ambulances and the techs on board have it so they know how to administer it. But it's going to be what we consider, and we've had discussions with the FDA about it as well, and they believe as well it may well be a breakthrough drug, unlike anything we've had before.
How do you take it into your system?
Intranasally. Basically, it will come as a powder, and it will have a nasal, like inhalant, where you just take it and directly put it into the nostril, and it goes right up into the brain.
So how long have you been working on this?
Well, the company's been working on this for a number of years. I got involved about a year ago when I was introduced to the company, because I thought that Prevacus had the ability to do so much for so many people. I mean, every day we hear a horror story about a vet who's committed suicide or is disabled. You hear about children sustaining multiple concussions, and, there's really no treatment for it. And then there's the whole drama of post-concussion syndrome. And this was all even talked about when Ivanka Trump's daughter injured herself playing gaga ball, and there was great fear that she'd had a concussion, and Ivanka chose to put on Instagram the whole notice of, be aware, parents, understand what's going on here. This is happening today. This is a problem with high-risk sports and others, but let's protect our children. And so we want to be able to not only deter a concussion, but through Prevacus treat a concussion to mitigate all of those horrible consequences from concussions.
Now, there is another additional story I want you to bring out about Dr. Jake Van Lendingham.
Yes. Jake is the founder and president of Prevacus, and he has been the driving force behind this, and he is a true force. But when he was coming out when he was in his graduate work of a late class, he walked out onto the street. He was in Florida when this happened, and a migrant person came up to him and hit him with a mallet several times, fracturing his skull. He almost died. They told him he would never recover, but Jake is not ever anyone to give in to anything. And here he is today. Now, did he do Prevacus because of that? He says no, but I'm sure the experiences and the rehab and all the work that went into him being back to a fully functioned, normal human being, if you will, probably left a very important imprint in his brain that something needed to be done other than what's offered now.
Besides I'm sorry, I'm going to mispronounce this,
That's
but you
okay.
can help me with this. Pre Vipro, first to market over
Yes.
the counter. Let's talk about that.
That is an amazing new product. It's going to be released next month. And I'm going to get you some samples as promised. It is a deterrent. It's an all natural cream, no FDA clearance, but you put it on either side of your child's neck or an adult's neck, and it mitigates the duration, some of the symptoms, and the effects of a concussion from any etiology, whether it be from high contact sport or from a car accident or just from a military operation. But it's a neuroprotectant, and we're very, very excited about being able to bring this to market.
Tell me where you are with FDA clearance and potentially breakthrough drug on with this one.
With Prevacus, we start our phase 1 in Australia, and then do the second phase. It'll probably, we've talked with the FDA. When we're ready for our official interview, we have to set up a preclinical meeting with them, but we've had preliminary discussions. We want to get an accelerated clearance so we can be on the market in 2 to 3 years versus 10 years, like a lot of new drugs. And so once we finish the phase 1A and 1B, we can then sit down with the FDA for a FDA preclinical meeting to determine what acceleration options we have and whether or not we'll qualify as a breakthrough drug.
When you're going through these clinical trials, and this is way out of my field of expertise, at what point can you start testing on human subjects?
Well, we've done a lot of work on animals so far, and our basic science work had excellent results. Now we're going to humans. This fall starts the first human trial of Prevacus.
Are you doing that in Australia, or can you do it in the
Yes,
United
in
States also?
Australia. We're going to do it in Australia, and there's a lot of reasons for that. There's a good population of patients. We've got some good contacts. It also is less expensive to do it in Australia than it is in the U.S., and the U.S. FDA accepts Australian data, so that's not a problem. The next phase of the human trials will be done in sites in the U.S., starting in Tradition, Mississippi, and that will be a full U.S. trial.
Why did you pick Mississippi?
The company picked Mississippi. Mississippi has given them a number of very good grants. Tradition is the center is a major research center in the U.S.
Hmm.
And it's close to Brett Favre.
Okay, okay, got it. By the way, tell the audience how his affiliation or association with your company came about, and what he's doing with you.
Well, Brett is probably one of the most amazing people that I've met, who has such high visibility, high caliber, lots of talent. He got very excited, and he and Jake are quite good friends. But when he heard what Jake was doing for concussions and the fact that he had many concussions, he knows exactly what it's like. He wanted to pitch in. He's been an investor of Prevacus, and he's also an investor in Prev Pro, which is being manufactured under Presol LLC. And he also is an owner in that company as well, one of the owners. So he wants to change the world, not just for children, but for adults too. And this is a game changer.
You brought up children, and I've been thinking about this all along. We've got a huge increase. I don't know exactly what the number is, but I know that there is a huge increase in concussions amongst children. Can you
Correct.
give our audience an idea of what's going on in that arena?
Well, absolutely. right now, the most recent reports that came out about 2 weeks ago showed a 500% increase in concussions in children. Good Morning America ran a whole segment with a doctor on it. And we have followed up with them to talk with them to see if we can talk with them as well. But, right now, there's no cure for it. And that's why we're so excited about coming onto the market with a natural botanical product that we've tested on children and adults that had no adverse events. But based on the studies we've done on the animals, we know that it gets into the brain in 20 minutes. It crosses the blood-brain barrier. It stays there for 6 hours and it peaks at 2. So this type of product will provide some protection to contact, whether it be from a football game or any dodgeball or any etiology, and can be applied twice a day, every day. I apply it twice a day, every day, just because if it helps with that kind of thing, it can help with, strokes and everything else. I do it as a prophylactic for me. But that's what it does. And we're continuing to study. Not only, we know that it's safe, and that's the key, and that's why we're going to launch it, but we're going to continue to study exactly the effects of the cream on the brain in animals, and also study what happens when Prevacus gets into the human brain.
What suggestions would you have for parents who are either concerned or dealing with the concussions?
My recommendation, and it mirrors what Ivanka said, which was so powerful on Instagram. We have to be educated, and we have to understand the symptoms, the signs, and we have to seek medical help very quickly when we know this has happened. And we want to look for ways to protect our children. We know that helmets are good, but it's not enough. So we have to be diligent. We have to be active. We have to recognize the signs. We have to know where to go, when to do it. And this becomes the job of a parent or anyone who has a relationship with a child who's, playing something as simple as I did as a child, dodgeball, volleyball, baseball, basketball. It's not just football.
I got it. It is. Marcy, aside from introducing you to the Dallas Cowboys, I've got something else I want to introduce you to after the show. But thank you for being a guest. Don't hang up. Thank you for being a guest on today's show.
Thank you so much.
You're welcome. All right, you've been watching CEO Money with Michael Yorba. Thanks for joining with us. Like us on Facebook, follow us on Twitter, and don't forget, download our CEO Money app. It's on Android and iOS.